All right. We are excited today. Our speaker is Dr. Xanthia Wiley. Dr. Wiley is an associate professor of medicine in the Division of Infectious Diseases and director of antimicrobial stewardship at Emory University Hospital Midtown. She is a co-investigator in several Emory clinical trials and is a co-investigator in the Emory Vaccine and Treatment Evaluation Unit. She is the Atlanta Hope Clinic PI of the National Multi-Site NIH Recover Long COVID study. Dr. Wiley is a member of the Emory Department of Medicine's Diversity, Equity, and Inclusion Council and serves as the physician lead of the Emory Healthcare COVID-19 Treatment Guidance Committee. Her scholarly contributions are published in journals including Clinical Infectious Diseases, Infection Control and Hospital Epidemiology, Journal of the American Medical Association, and the Journal of Racial and Ethnic Health Disparities. We are honored to hear from Dr. Wiley as she speaks today about team science, increasing the pipeline of Black, Indigenous, people of color, and women conducting clinical research. Welcome. I'm going to share slides in just a moment if you guys can be patient with me.
Thank you, Deborah. And thanks everyone for the invitation and for being here. I understand that many of you are librarians. You are my friends. We utilize you a lot, and a lot of the work I do on a daily basis is because of you all. Thank you. Okay, excellent. So I have no relevant disclosures. Next. So the objectives of this talk. So I'm going to describe literature supporting the value of workforce diversity just in general. So, in any field, whether this is library medicine, medicine, whatever. Discuss the current state of Black, Indigenous, and people of color and women conducting clinical research. And I want to outline and provide an example, specifically an example of my amazing team and how, an example of team science as a method to promote a diverse and equitable clinical research workforce. Next slide, please. So just big picture. So there's a lot of literature out there, about the science and value of diversity and the importance of closing the gaps in our understanding of inclusion and diversity. Next. So within this article, and I think that we can use this in any field that we're working in. What can we all do to foster diversity and inclusion, not just in clinical research, but in general? We can all, no matter what field we're in, being a mentor, sharing our wisdom with other people, especially trainees, celebrating each other's achievements, taking time to shout out other individuals who are doing a wonderful thing. Social media is a way of doing that. Volunteering and getting out there and representing those who may not have traditionally had a seat at the table. Giving seminars, giving lectures, giving talks, and this is what I do all the time. Let's go back one more. Yeah. And, what we're really going to talk about is building a team. If we want an excellence, building a team that is diverse and inclusive. And it's really important for us to check our biases. So even though my talk is going to be about team science and clinical research, I want each of you to kind of think about how you can foster diversity and inclusion in what you're doing on a daily basis and with your teams. Next, please. So I really love this article on the preeminence of ethnic diversity in scientific collaboration. So this was published in Nature Communications. Next, please. And what they looked at were they analyzed 9 million manuscripts and 6 million scientists, assessing the relationship between the impact and these 5 classes of diversity. So they looked at ethnicity, gender, discipline, affiliation, academic age. And what they found on this table next So big picture on the x-axis from left to right is increasing diversity. On the y-axis from bottom to top is impact. And in each of these classes, especially with respects to ethnicity, there's a direct correlation. So the more ethnically diverse your team is, the higher the impact and the higher the, excellence in the work that you're doing. So they saw this, increased, diversity indices in all of these, but this large box is especially with respects to ethnicity. Next, please. And if you look at the little red dots here, the red dots are health and medical sciences, and you can really see that association. So, diversity is not just about fairness and making sure that everyone is at the table, but this is all about increasing impact, excellence in the work you do. And we have evidence in 9 million papers and 6 million, scientists showing that the more ethnically diverse we are, the better work that we do. Next, please. And there's, strength in diversity. Of course, you can't read all of this, but I think it's really important. We want, as many different opinions with respects to the work that we do. And Richard Freeman, he actually does a lot of work in like health policy, et cetera. So let's just click next a few times. And apologies, everyone, since I can't run my own slides, but that's okay. But the most important thing that he shows is that manuscripts with 4 or 5 authors of multiple ethnicities have on average 1 to 2 more citations than those written by authors of all of the same ethnicity. So literally a 5 to 10% difference in the mean number of citations for a given publication. Once again, the more diverse, the higher the impact and the more citations. Next, please. And let's get to kind of medicine and science. So BK Tatangi, Dr. Tatangi, she was actually one of my trainees, and we're lucky enough to have her. She is now one of my colleagues at Emory. So she published this paper on a diverse physician scientist pipeline to fight structural racism. So there's this beautiful table next in here that kind of talks about on the left, what are some of the problems that we have with respects to increasing diversity compared to what are some of the solutions. So in this talk, the problem that I would like to address and that I'm really passionate about is low representation of Black, Indigenous, and people of color in the academic workforce and in research. How do we do that? Expanding the pipeline through mentoring and outreach, and the way that we were able to do it in our team is through team science. My other passion is all the way down here at the bottom is underrepresentation of BIPOC people in these research studies and clinical trials. So my entire career is around the top problem and the bottom problem and some of the solutions to make sure that we have enough, BIPOC academic researchers, et cetera, as well as within the research that we're doing, that they're fully representative. So what we're going to focus on during this talk is primarily the top blue problems and solutions. Next. So we talked a lot about diversity and equity with respects to work groups. Now let's talk about gender. So do not be surprised at all. Don't read this entire abstract, but let's do next. What we find is the exact same thing here, that while women continue to be underrepresented as working group participants, and this is actually a ecology and evolutionary biology paper, in peer-reviewed publications, if there is more gender heterogeneous authorship teams, there's 34% more citations. So again, can't tell you how much this is not about being fair. This is about ensuring that we have the opportunities so that we're producing quality science and doing awesome work. Next slide, please. So, if we know this, one of the questions that we had to ask ourselves was, where are the women when it comes to COVID inequalities in COVID-19 research authorship. So this was published in the BMJ Global Health in 2020. And what they showed is that between January and May of 2020, very early in the pandemic, women research authors were underrepresented. And having first author and last authorship positions was even lower. And if you look at this bottom bullet, women are underrepresented as authors in research papers in many scientific areas, and especially when it comes to first authorship and senior authorship. So over and over and over, I'm telling you that diversity equals excellence, equity equals excellence, gender inclusivity and equals excellence. But why is it that women and BIPOC persons are still underrepresented? Next slide, please. So although, it's hard to find actual data on how many women and BIPOC researchers there are, one of the things that we can do is looking at full-time women academic faculty by rank and race ethnicity. And this is from 2018, but just know it hasn't really changed all that much. And this comes from the Association of American Medical Colleges. So this goes from 2009 to 2018. And so what I really want you all to see is things haven't changed with respects to, full-time women, and we're looking at all women here with respects to rank and race ethnicity. So the purple at the top, these are white women, and they represent 65% of full-time faculty. And at the bottom, we're seeing are the remainder of our BIPOC, Black, Indigenous people of color. I think what's most concerning here is this hasn't changed. Not much has changed in the last 9 to 10 years. So women in general are underrepresented. And then if you just look at all women by race and ethnicity, BIPOC persons are really underrepresented as faculty members and as clinical researchers. Next slide, please. And also when you look at, with respects to rank, just take a look at the most colorful kind of portion of this, which is looking at the BIPOC. Purple are white women, and the other colors are everyone else. When you go from instructor to assistant professor to associate professor to full professor, the higher in rank, okay, you'll see that proportion of diverse persons decreases. So even as we kind of move up in rank, the number of Black women, Hispanic, women, Native American women decreases. So we have a lot of work to do. Next slide, please. So I, like many of you, I am from the South, okay? And I love to tell stories and hear people's stories. So I will tell you all my story, primarily because I did not start my career in research. So I want to share with you how I got here. So I am from a large family just in general. So in the middle, this is my 3 generations, myself, my mother, and my grandmother. So my mother was a single mother. This is me here with her in the upper right corner, me and my little red jacket. She was a single mom, raised me on her own, but I always had, wonderful, large extended family. And my mother is one of 8. I'm from a small rural town in Evergreen, Alabama. If you blink, you will pass it. And no one in my family had gone to medical school, and very few people had gone to a 4-year college. I was always a quote unquote smart little girl. So medicine wasn't even, kind of in my future, growing up. I knew that I wanted to be a doctor, but did not know if that would be possible for me. So I come from a small place with a lot of love and an amazing family. And to this day, there are kind of a lot of the motivation with respects to why I am really passionate about, racial and ethnic diversity, as well as gender diversity. I was raised by tons of women. Okay, next slide, please. So I did everything in Alabama to start off with. I went to high school in Alabama, went to the University of Alabama for college, went to UAB for medical school. But I'll be honest with you, during my my training, I didn't see a lot of, number one, people who looked like me in medicine, and definitely didn't see a lot of attending physicians, clinical researchers, etc., who looked like me. Most of my teachers were white women and white men. Next slide, please. But when it was time to apply for residency positions, so I did my medical school at UAB, it was time to apply for residency positions, and I decided, let me just kind of broaden my horizons, and I decided to interview at Emory, University School of Medicine, for my residency. And as you can see here in this picture, and on my first interview day, the thing that I noticed first was I saw faces who looked like mine. And as you can see in here, we have Black women, there were, Black men. And so that was a big part of the reason that I, decided to pursue training in Atlanta, is I saw myself and subsequently would really see the importance of having this diversity. So if you can click next twice. However, when I started, the two things I was really focused on were education and clinical experience. I wanted to be the doctor who was taking care of tons of patients. I liked to teach. I wanted to teach residents, but research, see, it's not circled here. I was not interested in research, or at least I assumed that I was not interested in research. Next slide, please. For 10 years, still did not do anything with respects to research. So I was a hospitalist at Emory Midtown Hospital, and saw patients, for thousands of patients, for 10 years, had an awesome experience, loved what I was doing. But the last few years, I realized I think I want to subspecialize. I was always interested in infectious diseases. These 10 years were fantastic. I really learned how to take great care of patients. And my colleagues here, this is just a few of them, we're still friends to this day. So this was a really instrumental time to show me how to take care of patients. Next slide. And not only did we, take care of patients, we, had a great time, and had fun, and watched each other have kids, and it was just a overall wonderful experience. But again, it was mostly clinical care and teaching. Next slide. So when I decided, okay, looks like it skips back a couple. There we go. So when I decided to pursue an infectious diseases fellowship, and I did that. These are my classmates. Did a 2-year fellowship in infectious diseases. That's when I first started saying, hey, this research thing is possibly something that I'm going to end up doing. Loved infectious diseases. Still had not published one manuscript. Had not done anything with research. Next slide, please. So, next, one more. So again, it was education, clinical experience, and then I started to kind of dabble in research. Next, please, and then started to publish. So loved, again, the clinical aspect. So I can remember sitting with my team. This was, in 2018. We had a patient who had HIV, a young Black man, and he came in with horrible hip pain, and we tapped the hip, and it grew this bacteria, Haemophilus influenzae, which is very, very odd, because Haemophilus is usually a bacteria that you see kind of in the oral pharynx. Went to an infectious diseases, just kind of general meeting, and was talking to some of my other colleagues, and they were saying, hey, we're seeing the same thing in some men with HIV who are having this invasive Haemophilus infection. So this was one of the first times seeing kind of a clinical scenario, literally patients that we saw that there was something not right. All of us got together. So what I'm really proud about with this manuscript is there were, I think, 10 to 12 of us who published this manuscript, and over half, actually the vast majority of us were women. From Lauren here on the left was the first author. She was a trainee. All the way on the right is Dr. Farley, who was my supervisor at the time. So even seeing women leading this wonderful work, and to have this published in JAMA, we were really proud. But again, the reason that I really got into this was my clinical exposure to said patient. Next slide, please. And over the next couple years, I was doing a lot of quality work. Was a hospitalist. I was really interested in antimicrobial stewardship, which is the appropriate management of antibiotics while in the hospital, and started, kind of thinking about things beyond my individual patients and collaborating with other women to publish this. But I'll be honest with you, these collaborations, I'm lucky enough to be surrounded by amazing, brilliant women. It wasn't necessarily intentional at this point. So we did, we put out great work talking about hospitalists as stakeholders in antimicrobial stewardship, and stewardship in poietic stem cell transplant. But again, this is not clinical research. Next slide, please. Um, and what we were also doing is publishing things that were kind of helping hospital operations and collaborating with other specialists. So Dr. Karuvela here on the left, she's an allergy immunologist. My colleague, Dr. Sexton here in the middle, she's infectious diseases. Doctors Langfit, Lindy, and Wolf were all anesthesiologists. So this kind of gave me a baseline of I'm working with amazing women, but I'm also really, having a multidisciplinary people of different colors, different, ethnicities, etc., doing a lot of this great work. Next slide, please. And including some of our pharmacists as well. So all the way on the right here, Dr. Jones has her PharmD, and we're doing work looking at hospital onset bacterial diarrheas, C. diff infections. So over these first few years, as I was as an academic infectious diseases doctor, pulling in a lot of these teams, and it was really gratifying work. Again, still did not consider myself a clinical researcher. Next slide, please. Okay, and kind of going back and continuing to collaborate and do work with some of my former hospital medicine colleagues. So all of us here, Dr. Clark, Dr. Tejedor, Dr. Witt, we were all hospitalists. So now I'm able to combine my prior career as a hospitalist with infectious diseases, coming together, doing great work. Also, I want you all to take a look at the diversity of degrees here. We have MDs, MPHs, MATs, registered nurses. The best work that I have done has been with more diverse teams. Next slide, please. Okay, so this is when everything shifted for me. Next, please. So COVID-19. So this, let's go back one more. Okay, so everything in blue here are all, as many infections, medical illnesses, etc., that we see disparities. Okay, Black people are disproportionately affected with respects to HIV, kidney disease. We hear a lot about maternal mortality, and we saw this with COVID. And I can remember really early on, this was like March, April 2020, before we started kind of describing, hey, we're actually seeing racial and ethnic differences. I was seeing that, taking care of patients. So this is when I became a clinical researcher, and I'm going to share with you some of the things that we did. Next slide. And again, a lot of the work that we did, this is not just about my patients. I'm thinking about my family members, my elderly grandmother, my little cousins, my aunt here that has on the white hat, she's a transplant recipient. So this work became really personal to me. We all know the disproportionate impact of COVID, even in rural communities in the South. So a lot of this motivated me as well. Next slide, please. So some of the first research that I did was published in the Journal of Racial and Ethnic Disparities on Age, Comorbid Condition, and Racial Disparities in COVID-19 outcomes. Really early in the pandemic, again, we're seeing these differences, and I wanted to describe these differences. I was seeing death on a daily basis. It was really impacting all of us. So what did we do? So my colleague, down at the bottom, you're going to see her a good bit. Her name is Nicole Franks. So Dr. Franks and I started working together. I can literally remember she called me one day and said, So I'm infectious diseases. She does emergency medicine. Xanthia, what are we going to do? And neither of us were researchers, but we started kind of pulling our brains together to figure out, what do we need to look at? What do we need to research? What teams do we need to start pulling together? And she and I have really collaborated over the last couple of years. And as you can see here, I show all of these images so you can really see the diversity within our teams. We are Black, we are white, we are, women, we are men, we are Asian. Okay, next slide, please. And not just, doing papers and things like that on like outcomes, really thinking about social isolation and social distancing. So Dr. Birkeland was one of my hospital medicine colleagues. This paper literally came out of us talking in the hall. I am single, I don't have children, I don't have a pet. Dr. Birkeland is married with 3 kids, etc. And she was talking about feeling isolated. I was feeling isolated. And then we're just like, just imagine what our patients are going through. So, pulling together and even thinking about social isolation in the time of social distancing and COVID. So much of my work has really come from these face-to-face conversations with my colleagues. Next slide, please. Also, looking at some of these clinical outcomes, racial and ethnic differences in clinical outcomes in patients presenting to the emergency department. So Dr. Patzer, all the way on the right here, she has her PhD and does tons of amazing work with health equity. In the middle here, the other Black woman, Lakin Smother, she was actually getting her MPH at the time. So on our team, we went from being and getting her public health degree all the way up to some of us having our MDs, PhDs, and actually putting out this awesome, important work so everyone would know about it. Next slide. And from a lot of this, the work and the research that I've done, I've gotten some national attention from that. To be honest with you, who cares? It's not really about me getting the attention, but being able to highlight some of the things that are really important. So one of the things, an interview that my aunt and myself did for the New York Times was on, rural and Black and Hispanic Americans turning to doctors who look like them, like me. Again, the importance of diversity, on the importance of getting COVID-19 vaccinations. And I recall my aunt here in the orange shirt. We're like slaving away with COVID. It's tough, really difficult. I'm so excited that these vaccines are coming. And my aunt, I called and talked to her, and she was like, "Oh my goodness, I may not get the vaccine." And I can remember my heart just falling, because my aunt is college educated. She serves as a bookkeeper, or before she retired, at our local school. Our family listens to her, and I'm like, "Oh my goodness, if my aunt is considering not getting the vaccine, we may be in trouble." So that's when I really started kind of extending the work that I'm doing from research to talking about COVID-19 vaccine hesitancy. Next slide. So, doing research has also been wonderful, because my institution, the Infectious Diseases Society of America, the work that we were doing, they were tweeting about it. So it wasn't just about doing the work, but getting recognized for the work, and everyone spreading the word about the disproportionate impact of COVID on our communities. Next slide, please. So, and it's not just nationwide. Dr. Franks and I, we needed to focus on our hospital. So a lot of people, when they think about Emory, they're probably thinking about the flagship tertiary hospital that's in Decatur. Nicole and I work at Emory University Hospital, Midtown, which is probably 2 miles from our safety net hospital, Grady Hospital. So most of the patients that we take care of look like, she and I. So this is when we really got together and said, it is time for us to pull this team together. We're not researchers, we are clinicians. Dr. Franks is actually the chief quality officer as well. So we had administrative positions, patient care positions, did not consider ourselves researchers at that time. Next slide, please. So so Emory offered an intramural grant opportunity, a request for a proposal. So we said, let's pull together a team. Everyone doesn't have to be researchers, and let's see what we can come up with. Okay, next slide. So the title of our proposal was COVID-19 Characteristics of Readmissions and Outcomes in Social Determinants of Health Study. And we said we're not just interested in our hospital. There are eight, many hospitals in Atlanta, but, 8 of us in the Atlanta system. So we don't have to keep it small. This is important work. Let's, kind of broaden things. Next, please. And we were awarded this. So this was one of the first grants that I received, and our team was awarded the $200,000 to do this work. Came right from intramural. Okay, next slide, please. And so, big picture, we're talking about diversity, we're talking about equity, we're talking about team science. So we pulled together a diverse team, and I want to let you all know that this was intentional. Okay, we included 8 hospitals. 6 of the hospitals were Emory Healthcare. Grady is our safety net hospital. We pulled in the Atlanta VA. We represented 3 healthcare systems: Emory, Kaiser, and Morehouse. And it was important for us. COVID wasn't just about infectious diseases. This was affecting everyone. So all of us, we're infectious diseases doctors, emergency medicine, hospital medicine, family medicine, and we were chief quality officers, chief information officers. So we wanted a big team. Everyone didn't have to be researchers, but we did want people who were kind of patient facing. So all of us interacted with patients so we can see what the problems were and try to address said problem. Next slide. And I love, and we're actually going to publish this soon. We looked at the demographics of our team members. Okay, so there were about 37 at the time that we did the survey. 78% of us were women. Okay, did we intentionally recruit more women? Absolutely. And sometimes that's what you have to do to make sure that you have a diverse and equitable group. 78% of us were Black, Indigenous, or people of color. And look at the languages. Of the 37 of us, we speak 18 different languages. All of us speak English, but take a look at all these other languages, from Spanish to Hindi and Igbo and Arabic. And one of my colleagues is from the country of Georgia, and Italian. Diversity. Because remember those first few slides? Diversity equals excellence. Okay, next slide, please. And when you have a big team, it's not even just about having academic folks. Sometimes I think we put ourselves in kind of little silos. So we had some who had academic roles, some who had non-academic roles. But as long as you had some type of patient interaction, we range from assistant professors, associate professors, we had 1 full professors, we had medical students, residents, and then over on the non-academic roles, nurse practitioners, physician administrators, some research quality staff, and non-academic physicians. So we diversified by roles as well. Next slide. And when you have busy clinicians who don't have a background in research, you have to ask people, what would you like to do? How do you want to use your time in this research group? Data analytics, data collection, manuscript development. Do you want to serve as a consultant? So we got a nice little variety so that we're not asking everyone to work on a manuscript if you're not interested and you don't have time, but people were able to contribute what they were, interested in doing. And I had not been a part of a research group that had done that in the past. Next slide, please. Okay, so we pulled together this team. We're diverse. We're, mostly women. We're from all these different hospitals. What have we been able to do in the last couple of years? So next slide, please. We have done national presentations, okay, at the Society of Hospital Medicine, American College of Physicians, and we're talking about like high quality, large associations, the Society of General Internal Medicine. And what was really important is, even though Dr. Franks and I were the PIs, we shared the wealth and we shared the presentation opportunities, because to get promoted, to do great work, you have to have experience in doing this. So Miriam, at the time, she was a medical student. Right now, she's a family medicine physician. Dr. Henry at the top, she does outpatient work. Dr. Ihiaku and Amzat, they're hospitalists. Over here at the bottom, Jasmine Hanna, she was actually our project manager. So we allowed everyone to do presentations and kind of pull things together. And these are things that they can put on their CV. Next slide, please. So we did national work. We have presented on the regional level at the Georgia CTSA. And for this one, I performed the oral presentation. But again, we wanted everyone to have the opportunity to present our data, our work. Because again, it's ours. It's not just mine and Dr. Franks. Next slide, please. And this is one of the things that I was really proud of. So Emory had an inaugural Health Equity Day in 2021, first Health Equity Day. And of all of our team members, 2 of the featured presentations were team members from our group. And we call ourselves the cross group. And on mentoring and on migrant work. So those were featured presentations. So let's go to the next slide. But of everyone in our group, 40% of our team submitted posters to the inaugural Health Equity Day. Just think about that. 40%. We had like 11, 12 posters. There were 70 posters at the entire Health Equity Day, and we had 11 of them. Okay, next slide, please. For the Division of Hospital Medicine Research Day, we placed second and third place. The presenting people, Dr. Perkins and then Dr. Kobaitsi. Again, my name is on there, Dr. Franks' name is on there, but we didn't present. We allowed other people to have the opportunity to present. Next slide, please. And we, continued to win awards. And we branched out even from the cross work and started looking at vaccine hesitancy. So it's not just about saying, here's the problem, there are inequities, but, what can we do about said inequity? So we, looked at vaccine hesitancy among healthcare workers. Dr. Ihiaku, Kushresha, and Kandaya are the lead authors, and we have published this as well. And I like that, we have a hospitalist, a family medicine physician, and an infectious diseases physician. None of them were clinical researchers by trade, but are putting out amazing work because we have, such wonderful collaboration. Next slide, please. Okay, and so thus far we have we're actually at 5 manuscripts now. There's 2 more that we've submitted and have been provisionally accepted. Our original cross manuscript, where I was senior, Dr. Franks was I was first, Dr. Franks was senior. The vaccine hesitancy piece, telemedicine piece, looking at health equity and telemedicine, and you see our senior and our lead authors are different, offering opportunities to everyone. Okay, next slide, please. And this is probably the slide that makes me the most proud. Okay, so on this slide is all of us. Okay, so there's 21 in the pictures here. I didn't have everyone's photos at the time. The vast majority of us were not clinical researchers. We, published this amazing work that we got together, thought about the idea, and I really think that we've been so successful, again, because of our diversity and because we, offer opportunity to everyone on the team. Again, diversity equals excellence. Next slide, please. Okay, and what we also did was we had weekly meetings, short and sweet via Zoom, 30 minutes, talked about manuscripts, talked about abstracts, and we congratulated each other on the wonderful work. So in 2 years, there was a lot of promotions. Dr. Franks got promoted to professor, myself, Dr. Henry, Dr. Kushretha got promoted to associate. Dr. Cantos was inducted into the Millipub Club, so with tons of citations on some of her work with some of the clinical trials. Julianne got promoted to data analyst 2 to 3. So again, remember that first slide, we promote each other's excellent work, okay? And we congratulate each other. Next slide, please. And This isn't just about doing this work. This is about, and I know that there are some community outreach people on here. It's about doing this work, identifying these disparities, figuring out what you're going to do, and then getting out in the community. So we were also under the umbrella of a COVID-19 collaborative community outreach and health disparities research group, okay? Which is essentially, yes, we can identify the problem. Yes, we can research it, but what the heck are we gonna do about it? And we do tons of work in the community, and I'll show you some of that. So if you can hit next twice. And when you do this work, show other people how to do it. So we, published a manuscript on a framework for mobilizing healthcare to respond to the community. We're already doing this work, so let's help show people how they can get out into the community to help. So Farron Epps, she has her PhD and she's a registered nurse. She's right next to me with the pearls on. She led us in this and had already done amazing work in the community with the geriatrics community. Again, look at the diversity in race and ethnicity and titles. PhD, RN, MD, MPA, MPH, etc. Keep things diverse. That's when it's going to be wonderful. Next slide, please. And I can't tell you how much work we have done in the community. That's what makes me so proud. We have spoken at schools. We've done, COVID-19 in the Latinx community. We've spoken at fraternities and sororities virtually. We've done webinars. We've done videos. They've been in Spanish. They've been in English. Next slide, please. And, we've done work. So, right here in the middle, COVID mRNA vaccines to healthcare workers. So not even just out in the community, but to, right there within our hospitals, we had to talk to people about the importance of COVID-19 vaccination. Something else that makes me proud, Emory was doing a, kind of promoting some of our research and things like this. And they were doing promotion in the Southeast and up the East Coast. So in Times Square, okay, on one of the subways, my picture as a clinical researcher with a little QR code next to my hair, will highlight some of this amazing work that my team has done. And what makes me the most proud, again, I can care less about being in the subway, but if a little Black girl or a little Hispanic girl with her cell phone scans that QR code and sees someone who looks like them and wants to do some of this work, that's what makes me the most proud. Next slide, please. So the last few slides, I just want to kind of show you when you are working in a team that is diverse and that's doing great work, people see it. So I got a random email from a high school student in March of 2021. And of course, I took her name out and she said, I'm a freshman at North Paulding High School. I have interest in molecular biology as well as biomedical engineering, and I plan to become an anesthesiologist. After hearing about your story and how you've witnessed racial disparities in the healthcare industry, I would be honored to have the chance to speak with you regarding the possibility of working with you on a research project. So this is a young Black woman, Black girl, she's 15 years old. She sent me her transcript. She attached her report card. So if you can hit next, please. So what this taught me and has always taught me is you can't be what you can't see, okay? This little, Black girl is interested in research because she saw a Black woman who was doing research. So, whether, you're a librarian lead or in the community or like me doing research, this work is so satisfying because, we're reaching people and showing people who may not have thought that they could do this, that they can do it. Next slide, please. And medical students. So, Kingsley Fortin Leong reached out to me one day. He heard me speaking and said, hey, I want to work with you. And what can we do? You do stewardship. I'm interested in race and ethnicity. And, he literally pulled together, thought of what he wanted to do, and wrote a letter to the editor at one of our infectious diseases journals on what about race and ethnicity and antimicrobial stewardship. And now his 4th year medical student project is specifically on this. So a lot of the talks that I give, some of the things that are out there is opening up more opportunities for more multidisciplinary and multi-ethnic work. Next slide, please. So let's go back to that very first slide. What can you do to foster diversity and inclusion? And I just saw this, this slide literally. I put this talk together last week. What we did in our team is exactly what this recommended. We mentored each other, we mentored up and down, we celebrated our achievements, we volunteered and got out in the community. We're giving talks like I'm giving right now. We built a diverse and equitable team and shared the work and shared the accomplishments. And we checked our biases at our meetings every week. And I hope that each of you, in whatever you are doing, can do a lot of these same things, again, to foster excellence. Next slide, please. And I'd really like to thank you all for your time. And if you can hit next one more time. And any of you, so some of the successes that I've had has been because I followed my dreams. So if there's something that you're kind of itching to do and you haven't done it yet, follow your dreams, whatever you end up doing, whether you're leading a team or a part of a team, keep it diverse, and you will have excellent work. So thank you for your attention.
Oh, right. Thank you so much. That was wonderful. I was unable to watch the chat for questions. So let's see if you have any questions or comments waiting. Let's see. You have a comment that this is fascinating and folks are interested in looking at your articles. They're wondering if links are available or if they can get a copy of the slides. Would you be willing
Absolutely.
to give us some slides? Okay, we'll make sure that
Happy to
those
do
come
that.
out. I will
Yes.
tell you guys, your CE credit will come, your slides and survey information. So just know that those things will be coming your way. And you got some kudos. Karen says, thank you for doing amazing work.
Thank you, Karen.
Oh, and Deanne already was on top of it and said that we'll be sure to share that information and citations. Um,
Thank you.
Man, you're getting lots of kudos. Thank you for your great presentation. I wonder if you've had any health sciences. Hmm. Sorry about that.
Okay.
Librarians as co-authors, research team members. Several of us are on faculty.
So I'm glad you mentioned that. I have not, and I wish. So I'm not sure if. So it seems like MUSC has librarians on faculty, which I think is awesome. I'm not sure if Emory does. Maybe they do. But you know what? I really think that we should not think that we should start including and incorporating librarians as well. Why? Because when it's time for these literature searches, who's the first people that we go to a lot of times? It's I mean it's you all. So thank you for that idea. Again, another way to kind of diversify our team, and we know that diversity equals excellence. So I learn something every time I give a talk, and you've given me something to think about.
That is a great point. One thing that I really love about MUSC, and I know all of you guys are across the country, is that we do have some strong interprofessional work and training that's built and integrated into the program. So I bet there are opportunities at your institution. It's a great point, something we can all think about.
Absolutely.
Yeah. Juliet says, thank you. Seeing all those kids reaching out just warms my heart. Yes, I really appreciate
Thank
that
you,
you brought
Juliet.
some warmth and caring into your talk as well. I agree with Juliet.
That's the thing. That's what it's all about. I think big picture, everything that we all do, from research to taking care of patients to national librarian work, we're all doing this for human beings. Yeah, at the at the end of it, you're not pulling manuscripts just to pull manuscripts. We're pulling manuscripts because we want the best care and the best education for everyone who's going to benefit from that.
Absolutely. Another question popped up. How many of your collaborators have gone on to engage in other research after working on projects with you, and they added, it often seems like research feels intimidating if you haven't done it, but then once you dip your toe in, you are more likely to continue. So how many folks
Oh,
have continued?
yeah. So of our group of 37, probably 50 to 75%. Yeah, and that's something else. So, we had our central kind of cross project where we're looking at the readmissions and social determinants of health. Then that went off into, vaccine hesitancy and then into telemedicine. And our network is getting bigger, bigger, and bigger. And to be honest with you, we even at one point had to ask a question like, how big can the team get? And how effective and functional will you get? So everyone, I'm just like, if someone wants to start up another side team science group, fantastic. But to answer your question, most of us, now you're always going to have within a team, there's some people who are going to want to publish and work on everything, and then there are some who still prefer patient care, and they were part of the cross manuscript and weren't interested anymore. But for me, it was dipping my foot in it and then realizing, oh my gosh, I love this. So give everyone the opportunity to kind of dip their feet in there and test the waters. And if it's for them, fabulous. If not, thanks for joining us while you did.
Excellent answer. So you're getting a lot more kudos. Someone said, thank you for a thoughtful presentation. They look forward to following your future amazing work.
Thank you,
Um,
everyone.
someone really appreciated the article about the relationship between ethnic makeup of authors and impact of the research. This is a great finding that we can promote at our institutions.
Please do. Please do. I mean, just think about it. Like we're talking 9 million manuscripts and 6 million scientists. And you're looking at a directly proportional relationship between impact and diversity. Because I'll be honest with you, you all may feel the same thing. Sometimes I feel like when we're talking about race and ethnicity, everyone kind of focuses on fairness and, um, affirmative action, and everyone kind of needs to be at the table. But people don't talk enough about the fact is that the more diverse the table is, the better the work there is. Exactly, Jeanette. It's just better doggone science. Yeah. So quit talking about fairness and exact numbers and things like that. If everyone on your team looks like you, it's a problem. And I thought about that as well. So our team isn't all women. It's not all by BIPOC. I have to make sure that I have white women and white men and Asian, women and Asian men on, as a part of our team as well. Yeah. Homogenous teams aren't better.
I will say I really appreciate that you're using a data-driven approach because I feel like when you're trying to make a case to people who are bottom line folks, the
Yes.
emotion is always important. The fairness is important, but that data-driven piece is what's going to get
Yes.
that buy-in from folks. So,
Agreed.
yeah.
Liberty, Deborah.
Any last questions? We have just a couple of minutes, and if not, that's okay. I'm going to watch the chat box. I wanted to give you guys one last reminder because I know you'll start to wonder. Give us about a week to get you that those slides, that CE credit information, which will be linked to a survey and the link to the recording. I think we might have completed it. Thank you again so much, Dr. Wiley. This was engaging. And you're getting mega kudos, and we'll be in touch. And we really
Thank you,
appreciate you
everyone.
making time to share with us.
Thank you so much. Everyone have a lovely day and thanks for everything that you all do.
Thank you too.
Bye-bye.
Take care of yourself. Bye,
Bye-bye.
everybody. I've ended the recording. So, Dr. Wiley, that was absolutely wonderful. Thank you so much. Your energy is contagious.
Thank you, Deborah. It always feels so good when you can feel the folks engaging and putting little clappy hands, and I felt the love,
It can
and
be
I
really
hope
hard to
that
do
everyone
virtual,
too.
but you made it warm.
Thank you. Thank you. So that was awesome. And Deborah, thank you so much for the invitation. Let me know if you need anything anytime, and I will get you all of the stuff I owe you after.
That's fine. I
Today.
totally am. You being here was the biggest thing. Everything else is just the little details. We'll be just fine.
Thank you. Thank you. So both of you have a lovely day.
Thanks, Deanne. Thank you, guys.
Thanks,
Take care of
Deanne.
yourself.
Bye.
Bye-bye.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.